But one of the questions that has been asked is, rather than these patients who are so late in their journey with prostate cancer, could Pluvicto be effective earlier in the treatment journey when the patients don't have so many other comorbidities associated with all the other therapies that they've been through? And so a randomized phase 3 trial was done called the PSMA-4 trial. And that essentially looked at comparing Pluvicto versus a change in androgen receptor pathway inhibitors in patients who had not been on taxane. So the question was, could urology providers essentially send patients for Pluvicto before they sent them for chemotherapy or taxane-based therapy to medical oncologists, with urologists essentially sending these patients out for nuclear medicine therapy and treating these patients second line once they'd had their androgen receptor pathway inhibitors. And so the primary endpoint for the PSMA-4 trial was radiographic progression-free survival. In the Pluvicto arm, it was 12 months, but in the ARPI arm, it was 5.6 months. So in patients given Pluvicto, they had a whole year in comparison to less than half a year of lack of radiographic progression of disease.